With over 7 million people infected with the virus, KwaZulu-Natal still remains with the lion's share of people living with HIV, with about 2 million infected people. A study aimed at looking at the prevalence, incidence, behavior and communication survey has started in the province. Researchers hope to update the current data on HIV. This will see over 400 data collectors going door to door to assess and test over 93,000 volunteers across the country. Volunteers will be selected randomly.
They assist in helping us understand where we are with HIV epidemic, and going forward, what are the drivers, both social and behavioral drivers of the epidemic, from which we can actually develop new interventions. Now we can concretely tell how many people in the country are taking ARVs, how many are virally suppressed.
Volunteers of the study will also be required to do a COVID test in addition to an HIV test. U.S. government representatives say the COVID-19 pandemic has reversed some gains made in the fight against HIV and AIDS, with many people unable to take their medication regularly.
Government health officials at the district, at the province, at the national level have been working very closely with PEPFAR partners to assure that everybody who is in need of services has access to the services, and working to bring people back whose treatment services were interrupted because of COVID-19 to bring them back into the system.
About 25,000 households are expected to participate in the survey.
It's critical that citizens from every district and every background within the province participate in the survey, and that they encourage their friends and family to do so to ensure local communities get the public health resources they need and they deserve.
The survey will continue until the end of the year. Simpiwe Makanya, SABC News, Durban.
For more on this, we're now joined by Professor Khangelani Zuma, who's the principal investigator of the study and also the executive head of the Human and Social Capabilities Research Division at the Human Sciences Research Council, the HSRC. Prof, thanks very much indeed for joining us. Welcome to the program.
Thank you for having us.
All right, so this is a massive undertaking, but valuable information that we need to continue fighting this battle. Hello, Prof, can you hear me?
Yes, indeed, this is quite a bit the largest of its kind since 2002. Can you hear me?
Yes, please carry on. Yes, please carry on.
Yeah, this is the largest of its kind since 2002, where we are going to be visiting 25,000 households, where we expect to interview 93,000 people that we invite to participate in this study. So this is quite a big study, where we expect that about 65,000 of them will provide a blood sample to be able to test for HIV, to test for viral suppression, the viral load, to test also whether people have been recently infected with HIV, and also to test whether people have been exposed to COVID-19. So we invite all people living in South Africa to open their gates when our data collectors from HSRC and our partners come to their households.
So this testing that you're doing now, what's different from the statistics that we've been getting over the last 20 years?
As you know, the epidemic evolves. Since when we started in 2002, there's so much that we know about the HIV epidemic that we didn't know then. So every time when we collect information, we advance in the way we collect data, the information that we collect, and more so at the moment we are compounded by another epidemic, the COVID-19. So we've got two epidemics that are colliding together, so we need to get more information, and hence the advance that we put in is that we'll collect also blood specimen to test for COVID-19, so that we can analyze and get to understand co-infections between HIV and COVID-19. So these are some of the advances that we add to understand the dynamics of HIV epidemic.
All right. Perhaps let me ask you in another way. Over the last 20 or so years, you have been getting statistics about HIV and infection rates. And I'm wondering what is going to be different about these statistics, because you've been gathering them over time. Are we saying that over the last 20 years they haven't been accurate? Have there been good guesses?
The statistics have been accurate over the years, but you will agree with me that one of the challenges is how the interventions that we put in place, how they evolve. For example, if you look at around before 2010, the statistics that we got about HIV prevention were showing that people were responding to the interventions, the condom usage, the market, the promotion of making people awareness campaigns about HIV were there. But actually now that has gone down. So there are a number of people who have grown over the years without even seeing any billboard or any information about HIV and AIDS. So I expect that the information that we're going to get will give us some new information, some new nuances that we have not unraveled before. And hence we're expanding in the sense that we collect information no longer only at national level, but we go to districts. So we are going to be we'll have information that could be extrapolated to 27 districts. So each of the 27 districts will have information that is representative of each of those districts. So this is much bigger than we've ever done before. So these are new statistics that we will be getting in this survey.
How difficult do you think it might be to get this sample size? Because testing someone for HIV, some people don't want to because they don't want to know.
That is why in this study, it's no longer only research, but it's a service delivery. In the sense that we go to households, we invite people to participate, which we hope our people in South Africa will participate in the study. And those that test positive, we then link them to care. We provide pre- and post-test counseling in the household. Those that test positive, we link them to care. Those that have defaulted on antiretroviral treatment, we again link them back to care. So it's not only a research survey, but it's also a service delivery where we bring health services to our communities. And I think with that, I'm very optimistic. And the participation in the areas where we've already started the study has been really great. People have been responding. People have been wanting to know their results. And people who have been wanting to know their results, and we provide their results back via SMS, for example, for COVID-19 tests, and people are quite excited about the study.
You must have some instincts about what this survey might reveal. What do you suspect might come through?
I am concerned. Although I'm a statistician, not a fortune teller, but I am concerned about access to antiretroviral treatment among young ones under 24 years. I'm also concerned about the numbers of people that know their HIV status and also accessing treatment. That these numbers, especially among the youth, are always a challenge, and I'm concerned that things are going to get worse from what they were before. And also, people who go to health facilities and also get to be tested and be virally suppressed, or put on treatment, and then so they become virally suppressed. We don't know what those numbers will tell us, but that is some of the challenges that we encounter, especially in the sense that the rates of new infections among young ones under 24, they are actually on the wrong side of it. So those are all the statistics that would be a concern.
All right. Is this going to shed some light perhaps on causes, behavior, so that something can be done to rectify?
The study collects information, we ask questions about all sorts of behavioral questions, knowledge, attitude. This is a CAP survey, so we ask questions on knowledge, attitude, perception, and behavior. So this survey will shed light, will provide information about the social and behavioral drivers of the epidemic. That is contained in the questionnaire. That will take about 45 minutes to an hour to administer. And that information collated and analyzed together will help us develop better interventions suitable for the current situation in terms of HIV epidemic.
South Africa has had this label over time of being the capital of HIV prevalence in the world. And I wonder if this isn't really more about us testing and tracking much better than a lot of other countries, because I find it hard to believe that when we look at Africa, there are some countries that have huge populations, and yet South Africa seems to be the one that's top of the COVID list, top of the HIV list. And I wonder if that is a true reflection of the situation on the continent, for example.
Well, I think I want to believe the statistics that we collect in the country, and also other fellow researchers in other countries that are collecting. You would be aware that other countries started dealing with HIV epidemic long before we really focused on this challenge that we face, HIV epidemic. If you look back, for example, in the early 90s, the focus in the country was a lot more about the change in the democratic situation in the country and less about HIV epidemic and the impact that it was having, whilst other countries had already started dealing with HIV epidemic. So there is a lot more that we still have to do to deal with HIV epidemic. But also one thing that we need to remember is that with more and more people being on antiretrovirals, people live longer. So the numbers of people living with HIV, they'll remain high because people still get infected with HIV, which is unfortunate. But also people live longer because they are on treatment. So the HIV epidemic curve is shifting in that way. So the numbers also we need to interpret with an understanding of what are the true drivers of the numbers that we see.
Your samples, are they going to include migrants? Because there's a lot of people coming in and out of South Africa all the time, and they play a significant part, I would suspect, in some of these numbers.
The study includes everyone that is living within South Africa, whether a person is a migrant or a non-migrant. As long as you are living in the country, you are invited to participate in this study. We invite people to be, to assist the country in making or bringing the country to where it should be, with people living happily and better. And this is the information that we are collecting that will help us achieve that goal of being a healthy nation.
I believe that you're linking this with COVID-19 tests. Why is that?
As you know, this is another epidemic that is ravaging our country, the global community, and there is so much that we don't know about COVID-19. So this will be the first study that actually collects HIV statistics together, or biomarkers that are used to measure whatever that is related to HIV, and we also test whether people have been exposed to COVID-19. And this will help us understand the drivers also and the interrelations between these two epidemics. So this is quite a novel way of dealing with two epidemics that are ravaging our country at the same time and the global community.
All right, we've run out of time, but perhaps to warn the public, what is going to happen? Do people come and knock on the door and say, we're doing this survey, can you be part of it? And is that how it's going to work? And I suppose identification and issues like that must also come up.
Our data collectors are professionals, trained, who are well trained, also taking all the necessary precautions to protect themselves and protect the community against COVID-19. The household have been randomly selected. Every house has a chance of being selected to participate in this study. Our data collectors will have cars that are clearly identifiable. They will have identity documents with the numbers also that people can call to confirm that They are authentic. We invite all people living in South Africa to open their gate. Let us collect this information. Let us be part of this community of researchers and conducting research for the betterment of our health.
All right, Professor Zuma, thank you so much indeed. We wish you the best with this survey, and we'll chat again once the results starts coming through. Thank you so much indeed for your time.
Thank you so much.